Many people ask me, hey doc, is testosterone replacement therapy good for me? Am I a good candidate? Well, we have spoken in other videos about if your testosterone is low, definitely that is something that can make a drastic difference in your health. We have also discussed how, for many men, now what it seems to be what is called the normal testosterone, the threshold of what is considered normal has actually been lowered by lab companies because it is normalized the standard person. And most of us are actually sick. 82% of Americans have abnormal blood work. So if you take what the normal of that is, then that gives you a lower threshold. And the main laboratory companies in the country have actually lowered the threshold of what is considered to be normal. So if you're feeling really bad and if you're having a lot of symptoms and your testosterone is in the lower end, this might be a good option to consider to improve your health. Especially after all of the studies that show how people with low testosterone actually have higher risk of cardiovascular disease, depression, low motivation, and it goes on and on and on. As a matter of fact, you might recognize out right here. In a way, it went through a major transformation. And of course, they did a lot of supplements. Of course, they did a lot of daily routines and habit implement and stacking habits together. But one of the main levers in this transformation was testosterone optimization therapy, in which the testosterone levels in Dana White from not being optimized to optimized. Because some of the benefits of testosterone replacement therapy are improving muscle enhancement and increased muscle mass and decreased fat. With that goes a long way in terms of metabolism, because then it's easy for your body to metabolize and turn fat into muscle, protein into muscle. Also, studies have shown time after time that people that have low testosterone levels are at increased risk of hip fractures and other bone fractures and severe osteoporosis. And so bone health has been directly related to optimal testosterone levels. And also, studies have shown that people with low testosterone levels have an increased risk of cardiovascular disease, like heart attacks. It used to be thought that testosterone replacement therapy were going to increase people's chances of having things like a heart attack. And that's why most doctors are horrified and scared of putting people on testosterone replacement therapy. However, over the past 15-20 years, more and more research shows actually quite the opposite. That people with low levels of testosterone actually have about a 33% chance of having heart attacks, higher than people who have optimal levels of testosterone. So overall, if your testosterone levels are low, bottom line is that having those levels optimal is going to improve your health in many different facets.